All right, once again, a very good afternoon to all of you, ladies and gentlemen, dear shoppers at Mid Valley Mega Mall. Hello and welcome to Focus Point World Sight Day Roadshow 2025. Allow me to introduce myself. My name is Agnes, and I will be your host on this meaningful session during the last final day of our World Sight Day Roadshow. Now, thank you so much for joining us. I can see there's a long line at our roadshow going for our free comprehensive eye screening. Now, ladies and gentlemen, in this roadshow, we bring together partners like Zeiss to provide free eye screenings, interactive activities, and eye health education to the public right here at Mid Valley Mega Mall. Now, this year's campaigns carries a simple yet very powerful message. Love your eyes, every story counts. Because behind every pair of eyes, there is a story. From sight to insight, every story truly matters. Now, as today marks the final days of our World Sight Day Roadshow 2025, we are closing it with something special. 2 interactive sessions to help everyone take that important step towards a healthier vision. So, ladies and gentlemen, to kick off our first session, we are delighted to have with us Dr. Malisa from Sunway Medical Center, Damansara, who will be delivering an insightful talk titled is Myopia Simple. So if you have ever wondered whether short-sightedness is just a simple matter of wearing glasses or if there is more of it, this session is definitely for you. Ladies and gentlemen, please put your hands together for Dr. Malisa. Hi, Dr. Malisa, please have a seat.
Agnes. Thank you very much.
Thank you so much for taking the time to join us today to share with us a very important topic about myopia. So with that, I'll pass the floor to you.
Thank you, Agnes. Okay, I'm Dr. Malisa, and I'm a pediatric ophthalmologist as well as an eye specialist at Sunway Medical Center, Damansara. So today my talk is about short-sightedness, which is myopia, and why is it an important condition to recognize in children and to treat them early. Okay. So is myopia simple? So I'd just like to acknowledge Focus Point and Zeiss for inviting me to give this talk, and also to Malaysia Advocacy for Myopia Prevention, MAMP. We are a group of eye health professionals who are passionate about driving the awareness program on myopia in children and to control myopia in children. And I'd also like to thank the chairperson, Dr. Nuraza Abdul Rahman. Okay. So just about my talk, what I'll be talking about. First, we'll start off with the anatomy of the eye, what the eye looks like, and how the eye works so that you'll understand the rest of my talk. And then what is myopia? Why is myopia a concern? And how to control myopia? So how do the eye see? If you have a look at this slide, on the left-hand side, the front part of the eye, the cornea and the lens, what that does is to focus the light that enters the eye to a sharp point on the retina. The retina is the back surface of the inside part of the eye, is full of nerve cells, and this light signal will then be transmitted through a nerve called the optic nerve to the brain, and that is how the vision will be processed and how we see. So all these pathways and structures have to be normal for the eye to see, for us to see things clearly and in a sharp image. So what is myopia? So in scientific terms, we call it's a form of refractive error, okay? So in myopia, like I mentioned just now, that the light has to be focused onto the retina so that you get a sharp image. But in myopia, this image is not focused on the retina, but it is in front of the retina. So that's why things look blurry from far, okay? So the image created is not sharp and it is blurry. So how a myopic person sees? So like in this picture, if somebody who's myopic, the far vision is very blur, but they can see things at near. But again, that also depends on what is the power of myopia. If you have a high myopia, even your near vision is gonna be blur, and you have to bring things very close to be able to see clearly. Okay, so like I said, far objects look blurry, but they're able to see near objects. That's why it is the layman's term is nearsightedness or short-sightedness. So when would parents suspect myopia? So usually it occurs in, when the child is growing up, okay? So what parents will notice is the kid might be squeezing their eyelids together when they want to look at something that's far away, because this streamlines the light so that they can see things a bit clearer. Or they can do eye rubbing and blinking because things are blur. And then sometimes the teachers are the ones that will notify the parents saying that, your child may have problems with their eyesight because they cannot copy things from the whiteboard in the classroom well, okay? And also in small children, they will come right close to the TV to be able to see clearly. And every time you put them back, they'll come back forward again, yeah? So that is an indication that they could have myopia. So the top picture there is just to show you that in myopia, the image is formed in front of the retina. So how to correct it is we have to put a lens in front of the eye to push that focus back onto the retina so that you can see things clearly. So the correction can be with spectacles, contact lens, or in some people you can go for the laser vision correction, which is like LASIK or SMILE. So once you put the lens in, once they wear glasses, then they can see things clearer in the distance. So if myopia is just simply corrected by glasses, what is the concern? Why do we as eye doctors want to educate the public about myopia? So it's a concern in children and teenagers because children are still growing. Okay, the eyeball gets longer as the child grows. So remember when we put the lens and the image is focused on the retina, but as the eyeball is getting longer, you can imagine that image will again fall short. And then you have to increase the power of the lens as the eyeball grows, okay? So you can get a higher and higher power. So if the younger a child develops myopia, because they are still growing, then the tendency for the power to go high is much greater because the eyeball is still growing until it reaches puberty, it stabilizes, and another peak around 16, 18 years old. So what is the concern about long eyeballs or high-powered myopia? It's because long eyeball is related or linked to retinal complications. So when we talk about high myopia, it's about power of -600 and above, and an eyeball length of more than 26 and more. So this can be termed as pathological myopia. And what's the concern with that, with this long eyeball? Because these complications can occur in adulthood when you're still in the working age group. So if you can have visual loss, and that will affect your work and your daily activities, okay? So what are the complications that can occur with high myopia? Number one is retinal tear and detachment. So that's a picture of the eye, and that's the lining at the back of the eye, and you can see there's a hole that goes through with that arrow. So that's a retinal tear. That retinal layer, because of the eyeball is very long, the retina is thin, it's more predisposed to having tears, and it can detach the retina. So this is an eye emergency and they need to be treated. So this is how it looks like when I look into the eye. There's a retinal hole on the top left part there on the picture, and then you can see that grayish membrane. That is actually the retina coming off of its attachment. So this is a cause of poor vision. So what could be the warning signs and symptoms of retinal detachment? So I would usually tell my patients who are myopic, whether they're children or even parents who are myopic, if you ever get flashing lights and then you see a lot of floaters, like a shower of black spots, then you should get your eyes seen to, and you should get a retinal examination, just in case if it's a retinal tear. Because a retinal tear, if it happens early, then the eye doctor can just laser it, and then it will be treated. But if you leave it for too long, then the retina becomes detached, then it will need a retinal surgery to reattach the retina again.
So what does too long here means? Like 1 month?
Weeks and months.
Weeks and months. Oh, okay.
So if you ever get those symptoms, at least within 1 week, you should get your retina examined. Okay. Another one that is actually quite devastating, because once it happens, you cannot reverse it, is the myopic maculopathy. It's a type of degeneration. So in that top right picture is how a normal retina looks like. When I look into the eye, this is what I see. The optic nerve, the retina is flat and nice. But what happens in myopic maculopathy, can I just stand up to show, because sometimes it's not that easy to see. If you can see the area at the center here, this area is called the macula. That's the area where we see most sharply for us to be able to read fine prints, okay? So in myopia, whenever the eyeball is very long, the retina is stretched, it becomes very thin, and all this tissue is thin, and there will be loss of cells. So that will affect your central vision, and it can be a permanent cause of visual loss. Yeah, so there's thinning of retinal layer, and in some conditions, it's not just thinning, you actually get bleeding. So you can get a hemorrhage, okay? So if that happens, when bleeding resolves in the eye, it will form a scar. So you can imagine that the scar is permanent. So whoever who has myopic maculopathy, when it happens and if there's a scar, they will lose their central vision. They won't be able to, if one eye, they close that eye, they use the eye, they close the good eye and then they look at something, they notice that they cannot see the person's face and all that. So it is a crucial part of our vision, the central part of our vision, okay? And it can be permanent due to the scarring and the loss of cells. Another common condition that occurs more frequently in those who have high myopia is glaucoma. And it's because the optic nerve undergoes degeneration a bit easier. Okay, so this is a series pictures of the nerve of the eye, the optic nerve. Again, I'm going to stand up and explain. So a normal nerve looks nice and thick. It's all pink here. So this is what I see when I look at the eye. So it should be nice and thick. So it's a nice, healthy nerve. But in glaucoma, what happens is it becomes thinner. If you can see the pink area is only up to here. This area in the center is actually hollow because the nerve, the cells have been lost and has died. So this is more advanced where, there's only a small slither of the rim of the nerve and the rest is already damaged. So yeah, that's what happens in glaucoma is the optic nerve becomes thinner over time. And glaucoma is also termed as the silent thief of sight because when it first occurs, what is lost is actually the peripheral visual field. So means it's only at the side that you lose the vision. So because we have two eyes, you hardly detect, somebody who has glaucoma won't be able to notice this when it occurs at the beginning because, the two eyes compensates for our visual field. So, but over time, it's gradual. Over years, you lose more and more of your peripheral field, and then you can live with a tunnel vision. And the peripheral vision loss is permanent. But in a very advanced glaucoma, even that central vision can be lost, and it can cause total blindness. Yeah. Another concern about myopia, not just the complications, but it's becoming more and more common. More children are myopic these days. There's increasing cases of childhood myopia worldwide. Okay, this is from the International Myopia Institute. So in some countries, like in the West, it's not as high, it's about 20% or 30%. But in Asia, in Southeast Asia, it's much, much higher. In some parts of China, it can be up to 80% of school-going children. So in Singapore, it's 1 in 2 in primary school children. So that is why you can imagine this could be a burden in the health services in the future. If there are more myopic persons in the world, then they will have a higher rate of complications. Then that will cause more of a health burden to the country. So there is a global rise in myopia. So this is just to explain that they have predicted in 2050, half of the world population will be short-sighted, will have myopia. That's about 5 billion. And 1 billion of these will have the high myopia, the power of more than 600. And it can become a leading cause of blindness. And the thing is, it can be a leading cause of blindness in the working age group. Means people who are still productive, yeah? Not in later age, not in elderly. So how to reduce the problem of myopia? Number one is we have to delay the onset or prevent myopia. Means for whenever a child's growing up, you want them to not develop myopia, or if they do develop myopia, that it will be later when they're older, in their teenage years. Okay? And once they do have myopia, you want to control the myopia progression in that child. You don't want the power to increase too greatly. You don't want the eyeball to grow too long, too rapidly. Yeah. So who are at risk of developing myopia? They're genetic factors. So if parents are myopic, their children are more likely to also become myopic. So if one parent is short-sighted, there's a twofold risk of their child having myopia. If both parents, then it's a sixfold risk. Also, environmental factors, because nowadays we are living more indoors, and then everything is more online. Tuition is online, lessons online. This all started with the COVID pandemic. Okay, so the lack of outdoor time, it will induce the eye to grow longer. So studies have shown that if there is increased outdoor time in kids, they are less likely to develop myopia. And also the long periods of near work. So the onset of myopia increases by 2% for every additional hour that is spent on near work activity. So again, like nowadays, especially, that's why you see myopia higher in the Asian countries, because we are very, driven in terms of academic success. Children are, they have tuition after school, they have extra classes, so they're always indoors, they're always doing near work, they're always reading, looking close up. So that's why we have a higher incidence of myopia. Okay, who are at risk of developing the high myopia, the one that's power of -6 or -600 and above, is, like I mentioned before, the younger the onset. Means if a child develops myopia at the age of 3, 4, then that child has a higher potential of reaching 600 or even 1,000 in terms of their power when they reach 18 years old. Okay, and also the glasses power at the onset. If a child is detected even at 7 years old, but they already have a -400 power, then of course that will go even higher as they grow older and grow taller. Yeah. So now is the important point, how to control myopia. So the good news is, for now, we do have modalities or therapies that we can control the elongation of the eyeball. So the myopia onset can be delayed. If possible, this is the best, because prevention is always better than cure. Okay, so you want to prevent the onset of short-sightedness. And if it does occur, there is treatment that we can control. Okay, but bearing in mind, this has to start in early childhood, before the child develops short-sightedness. So how to delay or prevent myopia? Like I mentioned before, it's the outdoor time. You have to spend time outdoors. Kids have to spend time outdoors at least 2 hours per day. I know it is a little bit difficult to achieve, especially in Malaysia, in the urban areas, but you just have to try your best. If you can't, you sort of top it up over the weekend. Spend more time, get the kids to do outdoor activities, go for swimming classes, go for play badminton, do more sporting activities. Yeah. So you should increase the time outdoors. More than 2 hours a day is strongly associated with a delay in the onset of myopia. And studies have shown this very well, that it will reduce the myopia incidence by 50%. Okay. And another thing, how to delay and prevent, is avoid the prolonged near work activities. So this is like intense reading, spending too much time on your digital screen, on iPads and handphones. So we have to control this in children. Increased time in screen time, spending too much time on screen time is not just, to prevent myopia, because there are other things is associated with having too much screen time. Children are getting more obese nowadays because they don't have physical activities. They're always indoors. And they can have some social or psychological issues with spending too much time on digital screens. So cutting down digital screen time in children is beneficial overall. Yeah. So what is the treatment for your myopia? First thing is you have to correct it. There is always a myth thinking that, doctor, if my child starts wearing glasses, wouldn't that make the power go higher? No. Actually, if your child needs glasses, then they should start wearing glasses, even if they are still young. Because if you don't correct that blurriness, the child will strain every time they want to see far, and that actually drives the eyeball to grow longer and the myopia power to go higher. So you have to treat myopia. You have to give them glasses. And these are the current treatments that can be given. Once a child is myopic, there are some modalities that we can introduce to slow down the progression of the myopia. And what is well known and is well established and well studied is the low dose atropine eye drops. Okay, this has been used more than 10 years in China, in Taiwan, in Singapore, in Hong Kong. Though those atropine eye drops is like, parents already know if their child is myopia, they'll go and get it treated because it's so prevalent there, and they have studied this for a long time already. But there are also non-medical treatments in terms of not eye drops, but you can have them in the form of glasses or lenses. So that's what we call optical interventions. So there are now myopia control glasses, okay, that can help with reducing the rate of myopia, reducing the progression of myopia. Some contact lenses are also available. So this is just, I know it's a busy slide, it's just to sort of show that, atropine, low-dose atropine has been well studied, and it has been shown that it can reduce the progression of myopia. There's huge studies in Singapore, in Hong Kong, as well as China. There's no serious long-term side effects, okay? Usually when we advise or counsel a parent about their child going to myopia, we say, if you want your child to start on low-dose atropine, you have to be committed. It has to be instilled every night, for daily, to be able to see the effectiveness at least for 1 or 2 years. If they're only putting the eye drops twice a week or 3 times a week, then it's not going to be effective. It has to be very regular in using it, okay? So usually we do start with a lower dose, 0.01%, and then we'll see the effect. And the important thing is once you start, it should be monitored. So every 6 months, the eyeball length should be monitored, or the eye power, so that we know, is this treatment working or not? If it's not, then we have to consider other types of modalities to try and help control the myopia. So now, like I mentioned, there are myopia control lenses. So the ones that studies have proven that it does help is the DIMS lens, DIMS, the HALT lens, okay, and also the CARE lens. So it's a Hoya MyoSmart, Essilor Stellars, or Zeiss MyoCare. But again, the most important thing is once you start, you have to monitor. Because if you just start and you don't monitor, then you don't know whether it's working or not, yeah? There are also contact lenses. They can come in the form of soft contact lens or hard contact lens. So all this treatment is available. What I would like to highlight is, please do bring your child to see either an optometrist that offers myopia control or an ophthalmologist that offers myopia control if you feel that their power is getting too high too rapidly, because now there are treatment. Yeah? So what can I do to prevent myopia in my child? Okay, this is also another busy slide, but it's just to illustrate. Number one is increase the outdoor time and sunlight exposure. So outdoor time means during the daytime. So there are parents who say, "Doctor, I bring them out, after dinner at the playground because our playground is covered." I was like, no, that doesn't count. It has to be during the daytime and at least some sun exposure, not an indoor activity. Yeah? Reduce the near work and the screen time. Also, so you have to have frequent breaks from near work. So means I would always advise the rule of 20, 20, 20. After 20 minutes of near work, whether it's your handphone, reading, your books, or iPad, computer, take a break by looking far, 20 feet away, which is 6 meters away, for 20 seconds. So this reduces the eye strain, and this relaxes the eye muscles so that it doesn't become strained, because that eye strain causes the eyeball to want to elongate even faster. And also the viewing distance. So for handphone and books, for kids, they like to bring it close. So tell them no, hold it a bit like an arm's length, 30 centimeters, because that is less straining to the eyes, okay? And of course, balanced diet and nutrition, omega-3, fish oils, because they contains a lot of antioxidants, and that helps the health of the retina. And the sleep hygiene. Studies have shown that adequate sleep also, poor sleep is associated with a faster myopia progression. This is the rule of 20-20-20 that I mentioned earlier. So it's just for you to understand. Every 20 minutes of near work, relax the eyes by looking 20 feet away for at least 20 seconds. So the take-home messages: if you suspect your child is myopic or having difficulties with their eyesight, please get them checked and to get the treatment early. So prevention of myopia begins in early childhood. So you want to prevent your child from actually becoming short-sighted. So let them play outdoors a lot, okay? And myopia has to be monitored as the child grows. So you want to know if they do start any treatment, then you want to know that it's actually effective, or if not, they need to switch to another form of therapy, okay? And myopia can be controlled with the right treatment. So you can look up MMMP's website for more information on myopia and myopia control, and we also have a Facebook. Thank you.
All right, thank you so much to Dr. Malisa. Before she wrap up her sharing, anyone has any questions regarding myopia to Dr. Malisa, you can raise your hand. We will give you the mic for you to raise any questions. For any parents out there, if you have any questions regarding myopia or short-sightedness happening to your children, if you have any questions, you can always raise your questions. Anyone? Okay, perhaps me. Okay, so just now, Dr. Malisa, you mentioned about early detection of myopia in children. So at what age do you recommend the parents to bring their children for eye screening?
Okay, usually it's good in their preschool age. In developed countries, in the Western countries, in Australia, New Zealand, in Europe, in US, they have a vision screening when the child enters kindergarten, around 3 to 5 years old. So it's good to have an eye check then, because sometimes they might have, poor eyesight, whether it's long-sighted or short-sightedness, or if they might have a squint, which is a misalignment of the eyes that parents don't detect. So it's good to, at least at the preschool age, to have a check then. But if you have any concerns that you feel that your child is not seeing very well, by the symptoms that I said, they're squeezing their eyes, they're not attentive to the environment, they have a certain head posture when they want to look at something well, okay? So then that's when they should be seen sooner. Or if any family history of any childhood eye diseases.
I see.
Then afterwards, once they're preschool, then you can another check is before they enter standard 1, around the 6-7 years old again.
So after the first checkup, usually how long to go for follow-up checks?
If everything is normal, like I mentioned first, at least preschool age, 3 to 5 years old. The next one is around 6-7 years old. And then if it's normal, maybe sometime in their teens, every 3 years or so, every stage of that childhood growth, yeah? So before, say, between primary school and secondary school, so that stage, you can have another eye check.
All right, thank you so much for the insights. Thank you once again, ladies and gentlemen. Please give a big hand to Dr. Malisa for the insightful sharing. So yeah, I think many of us has learned about myopia. It is not as simple as just wearing glasses. It is about the early childhood, the early detection, and also the lifestyle habits, everything, do affect the myopia. So it is recommended, to get your eye check, regularly. And for children, it should be getting their eye check done at the age of 3 to 5 years old for their first eye screening, if everything looks normal before that. All right, so ladies and gentlemen, once again, a big round of applause to Dr. Malisa. So also a big thanks to Zeiss as well as Focus Point, to MAMP for collaborating with us in this roadshow. Thank you so much.